Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed every year in the U.S., and unfortunately half overall will not obtain the desired outcome. 10% will actually end up worse than they were before the surgery. The first consideration is whether or not to seek a second opinion. A second set of eyes may be indicated since it really is a big decision. That second opinion may recommend the same surgery, it may recommend a different surgery, or may recommend no surgery at all, depending on what you're dealing with. The second consideration is, have you really tried all conservative options? Most back surgeries are elective, so you really should put some time into trying physical therapy, chiropractic, maybe spinal decompression therapy, acupuncture, medication management, and then interventional treatment such as you see here, which is radiofrequency ablation. The third consideration is, have you done a risk-benefit assessment before undergoing the procedure? No spine surgery is going to be risk-free. Adult scoliosis procedures, for instance, have over a 50% complication rate. It may be anything from infection, bleeding, nerve injury, anesthesia risk, failure to fuse, or scar tissue, or even worse, okay? The fourth consideration is to really do a reality check on the potential outcomes. Half of back surgeries, as mentioned, don't end up with the expected outcome, 10% end up worse. Let's say half your pain goes away after the procedure. Is that good enough? Okay? For an example, the FDA study on the lumbar artificial disc, here's a model of the lumbar artificial disc. Now, this was a study where the FDA approved it in 2004. Well, what they found is when they compared patients who had this procedure versus a one-level fusion, over half in both groups still needed narcotics a year after surgery. So that means that not all the pain went away. Is that good enough? Okay. The fifth consideration is to consider the timing of the surgery. For surgeries that are elective, you can pick the best time. Summer break, a sabbatical from work, a long weekend, whatever the case may be. You have to look at the rehab considerations. A laminectomy, maybe 6 to 8 weeks. A spinal fusion, maybe 3 to 6 months. Adult scoliosis, maybe 6 to 9 to 12 months. Okay, so that needs to be taken into consideration because the physical therapy and rehab afterwards is just as important as the procedure itself. The bottom line is that the objective is to feel comfortable with the decision that you make regarding surgery, even if the desired outcome is not produced. Okay, it's reasonable to work through these 5 considerations to make sure that it is the right thing for you to have the surgery. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are lots of clinics throughout the state accepting over 50 insurances and providing over 25 treatments with the board-certified, award-winning doctors. Visit us online today at painmanagement-atlanta.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.